it's an amazing thing that everybody's always looking for the trick.
My Seymour was diagnosed with meningomyelitis and is now paraplegic. Besides a wheelchair, do you have any advice to keep him happy and as healthy as possible?
Education is what you use after you leave school, or it's a sense of school gets you the basics,
right?
But it's that experience that does it. But they always talk about that. It's like you can read only so much. You got to implement it in, and you got to apply it,
right?
And
the more you apply it, it opens a lot of doors for you too.
And you really fully understand what you read.
Yeah.
And I hate the fact that we get so many people in your field and in my field that read a book and then suddenly the Dunning-Kruger effect, that they know more than the expert without any experience.
My buddy, you may know him from the work I wrote, Chance White. He's in Austin, Texas, and he calls me with the problem with his dog. And they wanted to put this dog. The dog was coughing and wheezing. Older dog, 13-year-old little Chihuahua, and they thought maybe it's time for him to sleep. And I thought that's pretty quick. What about the heart? Let's test things first. And they realized that the heart, they finally took it to a cardiologist. They did an an echocardiogram. Heart was actually pretty good. So they think it's a primary pulmonary problem, lung problem. So they're doing all sorts of stuff. They want to put it on. And I said, well, if we're dealing with an old dog and it has some sort of pulmonary problem and it's not heart, it could be like an allergy, it could be an irritation, it could be an inflammation. I try to go with steroids, just a moderate dose of steroids. Sure enough, this dog literally is out of the hospital without needing extra oxygen from an oxygen cage in 2 days.
It was just,
and this doctor wanted to think about euthanasia.
Again, experience comes into play, trying different things, and then it's cool that somebody from Texas is calling you going, oh yeah, I like my vet, but I'm going to go to the guy that I really trust. I love the fact that it was so similar to what the fitness world is working with right now, our discussion. And I know our discussion is about animals and dogs and the ability for you to continue to do what you do, regardless of the negativity that you get. Not saying you get a lot of negativity. So just understand that. Go follow Dr. Jeff Werber, and he's on my pages everywhere. And he's got the blue check mark, so you know it's him. But
finally,
it's an interesting thing where you can take two fields completely different, and there's similarities all the way through it, from two people not being able to do the same diet, to two people not doing the same workout, to two dogs probably not doing the same exercise. I know, like, big dogs don't need as much exercise as the Huskies. Or,
you know, I remember a couple of years ago, you and I talked about this, and I find it was also very fascinating. It relates to this tremendously. It was that diet that was out there. They had the 3 or 4 athletes that were doing the vegetable diet.
You called me on this, yeah.
All right, and basically poo-pooing meat, protein in any way, shape, or form. And you even said that could be good for the right person. But there are people out there that may not do well on that diet. And when you look at all the fad diets that have gone in for heart health, for example, including the Pritikin diet way back, and they found there were people who dropped dead from that diet.
And himself. It's an amazing thing that everybody's always looking for the trick.
Right.
The one little catch, the one little thing. And it comes down to everybody's different. Everybody deals with the positive, negative. Everybody loves the underdog story, and I think that's one of the biggest things that you guys got to see today is the underdog story with this dog, who again, right? What a transformation! And most of the time, I cannot watch those videos. And Mickey Rourke sends me these videos all the time, and I'm like, I'm not going to be able to do this tonight. I can't. They're so emotional for me. But I think it's incredible that you can still do it with such a smile, the way you do it. Yes, Mona. Yes.
Everybody thinks now, because they see you guys doing, talks together and podcasts, they're like you're getting special treatment from Dr. Werber. But
they all get special treatment.
I have news for you. You're not the one that's getting the special treatment only. Because when I went to the office, this guy He's literally treating everybody the same. It's mind blowing. I've seen him with to customers, and it's just so amazing to see the same attitude. This like just your body language is not different when you talk to Mike or that somebody just walked in. And I love that about you. And one more thing, I don't know if all this facility do it, all the vets, but you guys take in older dogs to actually bait them and groom them.
Yeah.
And a lot of people don't do that, the groomers anymore, because they don't want to deal with an old dog.
Right.
And I love that about the facility as
Yeah,
well.
so just if you guys didn't hear that, the 2 points is that I get special treatment because I do a lot of collaborations. They all do, and that's one of the biggest things when I'm at the office or Mona's at the office with the dogs. He's this way with everybody, and I've sent everybody that I know over there to his facility because I know what each person will get with the staff and with him. So it's a cool thing to see that.
Well, plus, the thing is, like you said, is that you working out. It's not a job,
right?
What I do is not a job. I never looked at it as a job, and it brings me so much joy. So why wouldn't you do something
that you really
love doing? And except for for you naysayers, right? The feedback. It's like my wife always says, Jeff, of course you love going to work because they all love you. And even my patients. So many people will say that I can't believe it that he hates on vets usually, the dog. And my patients.
What he's saying now is I can actually verify it. Bunny, my baby girl, my first adult dog, was very testy. And his first visit with Bunny, he got down with Bunny and Teddy, and you guys all know Bunny and Teddy. And he got down there, and Bunny went and it was just like that movie. I'm running, and she was aggressive, and she gets right to him, and she's like, "Okay, I love you." So, but he gets right down. You get right down to them. The things you tell us not to do. You're so schooled in this that you set yourself up in a correct way to be able to do what the amateur should do.
But again,
what the amateur should do.
And I can read dogs pretty well. And when I think of the number of years of doing this, and the number of times
you really are the dog whisperer.
It's very few relation. I've got nailed before, and I say this: if any veterinarian who says they've never been bitten by a dog, they are not really interacting with that dog. There's no way, because the dogs are unpredictable. You learn after years what to look for, signs. But I've been nailed.
You were great with my girls, and
fortunately, most of them I joke I get more tongue than anybody I know. But
going to work and getting tongue all day long.
They lick me right in the face. But this, it's good. But there are those veterinarians, these young vets that are taught, oh my God, don't
control your dog, don't.
And they won't. They tell them to put an imaginary bubble around their heads and don't get any closer to the dog than that bubble. I'm thinking to myself, how can you love on an animal if you're wearing a bubble around your face? You get in there, get the hugs, get the kisses.
People ask me, they go, why do you still lift the way you do that kind of scrappy fight every single day? And it's because I freaking love it.
That's right.
I freaking love it. And going to the gym and not being me or scrapping. Even today, we had a young little 20-year-old in there, and it was like rep for rep. I'm like, let's go. Let's go, youngster. And it's just so fun for me. But like you said, we don't work. We have fun doing our lives. Let's see if we got a couple of questions here, Jeffrey.
Yeah.
If we got anything here, and if you guys got any questions as well.
My dog is a rescue. How do I treat clinging issues?
Ooh, this is
cleaning what?
Right. Clinging.
Oh, clinging. Yeah. So what happens is, it's a tough one because when you have these rescue dogs, they've been deprived of that interaction. So all of a sudden you see this dog and there's a connection and you bring it home and you are crazy about the dog and the dog is now crazy about you. And they start becoming extremely used to that. And it's almost like codependency. So you want to reward the behavior when they're not always so clingy. And so, for example, dog comes up to you, it wants to be picked up, or it wants to jump up next to you. So you can either just get up and walk away, Or the dog can sit there with his head, on your lap, like, okay, pick me up, and just kind of ignore it. But when you see the dog,
boy, that's tough for us dog owners to do, though.
But when you see the dog sitting on his bed,
yeah,
chewing its own toy, then you go over to him and say, "Good girl, good boy," and give a little treat. So you want to positively reinforce the behaviors that are not always dependent on you, like we do when you remember that.
So I'll give the a scenario that I got a lecture from this man. I got yelled at, and the reason why is because I had a pup, Elvis, right there. That's Elvis, and when I got Elvis, I sheltered him because my schedule was not productive for dogs, and I thought because I had Bunny and Teddy, and he was playing with them, and it was in the house, and I had a great yard, and they could play all day, that I was a good dog owner. I didn't realize, because I kept him there for the first couple of years, didn't take him to parks, didn't interact him with other dogs, didn't do any of this other stuff, I set him up to fail, and I was a bad dog owner. And you told me, you go, no, when they're young like that, you got to interact with other dogs.
Right. In other words, the world can't revolve around just you and the dog. The dog has to become, as we call it, socializing, and be comfortable. And not only that, be comfortable in your environment, the home environment, without you needing to be there. And it's not easy, especially. I mean, it's great that you have adopted a dog, and it's great that you have this bond that you formed. And the dog loves you, and you love the dog, obviously. But there has to be times where the dog can't always get you when they want you.
And I really realized with Elvis how much I loved Elvis, but what I did wrong as a dog owner. And then you're like, wait a minute, I thought a dog owner, all he has to do is feed the dog and have him in a house. Yeah, that's your job. And it's like, that's not even close to the job.
Right.
And so it took me as a young boy to understand that. And
well, there's a school out there. And I have many pets. We have 10. And I joke that if they made a bed bigger than the California King, I could get more. And I have all 5 of my dogs usually sleeping on the bed. And they're veterinarians and need veterinary behaviors. I said, oh no, you should never have your dog sleep on the bed with you. To me, who needs a blanket when you have all that coverage, right? But I disagree, and that's what, as they say, that those opinions, that's what makes horse racing. Right. But there is a school of thought that you're making the dog too comfortable, and you have to set boundaries. And one of those boundaries is a dog gets to sleep in his bed, his or her bed, or his or her crate, and maybe that would have eliminated some of this congeniality and the closeness. But for me, it's worth it to have that dog feel close enough to me, and yet you can set boundaries in other ways.
Yeah, I like that you got that approach, because I wish I took Elvis more to the parks and got him involved, because I am like you. Those dogs are on the bed with me and playing and roughhousing and all that stuff. Great question, though. Really good question. Thanks for bringing up that pain of me getting yelled at. Really appreciate that. Let's go to the next one.
All right. From Mary. My Seymour was diagnosed with meningomyelitis and is now paraplegic. Besides a wheelchair, do you have any advice to keep him happy and as healthy as possible?
Well, I wonder if any surgery was done. If there was surgery done, then it might have relieved some of the pressure. Now, with something like that, also, when you see the letters ITIS at the end of a long term, that's inflammation of the meninges. So meningitis. And so the thing is, culturing, CSF tap, maybe even a CT or an MRI. But if there's a lesion, that's a tumor, then there's not much you can do. But if I knew that we're not dealing with an infection, either a fungal infection or a bacterial infection, and I would also mention that I would consider a course of steroids and see if we can decrease the inflammation. And that may have been done already. And now, interestingly, we talk about the young versus the old.
Let me stop for 1 second. So, Mary, if you're listening to this, which I hope you are, make sure to respond to some of these statements that he's making right now. If some of this stuff was already done, Okay.
And I have been a fan, again, old timer, of the corticosteroids. There are also something called NSAIDs, non-steroidal anti-inflammatory drugs. Things like naproxen and ibuprofen, right? Aspirin. Those are NSAIDs. And a lot of the younger neurologists now are advocating the use of the NSAIDs. And I have to tell you, I talked to some veterinary surgeons that I've known also, part of the older school, and we still feel that steroids for some of these things are a better way to go. So I would talk to your vet, try both. Fortunately, you have a dog. I imagine it's a small enough dog. It's doing the wheelchair.
It is not a small dog. I actually know Mary, and it is a pit or a rot.
Really?
Rottweiler.
Wow. Getting those big dogs into the that's tough.
Yeah.
Because that's a heavy dog to put into the wheelchair. You got to put the legs in those stirrups, and I applaud you for doing that. That's tough to do. And also, I had a dog patient that was a dachshund who had a disc disease, which is much more common in dachshunds.
Common dachshunds.
All right, paralyzed. Had the surgery. Surgery they thought went well, but it didn't work. There's a perfect example. Board-certified surgeon did everything right. And the problem is the dog didn't read the book. So it didn't do well. Had it on the wheelchair at the canine cart. 2 years later, the owner noticed that the dog's, even though it's in the cart, its back legs are starting to almost paddle. P.S. Another 6 months later, cart's in the garage, dog is walking again.
Holy sheesh! So it was just the inflammation at
It
that
took
point.
that much time.
Wow!
It was damaged from obviously the initial disc shooting up into the cord.
Right.
The cord
Which
did not
happens a
look
lot with
disrupted.
dachshunds.
Right. The cord did not look disrupted. The surgeon thought the outcome would be better than it was, and yet it didn't happen. But it did happen.
It didn't happen in
years
time.
later.